Frozen shoulder, here's what to expect. Understand the mechanism of his injury, of how the actual shoulder was injured in the first place, the actual structures involved, whether it's the muscles, tendons, ligaments, and just in general what your limitations are going to be key to understanding the actual treatment method and really what to actually treat when it comes to treating frozen shoulder. Many times it can be thrown around as far as adhesive capsulitis, being a little bit fancy with the diagnosis, but understanding what that means is just the inflammation of the capsule itself that surrounds that shoulder joint. So getting clear with some of these terms and understanding what your limitations are going to be key to understanding what your treatment method is moving forward. Many times we have to look at it from a standpoint of understanding, is your limitation of moving the arm due to just pain, or is there actually restriction, which is the frozen shoulder, that adhesive capsulitis of something tightening up that actually keeps us from moving it whether you're trying or not, meaning if someone's going in there and even helping move it for you, such as a therapist or someone that's trying to go in there and help stretch the arm, they can't move it themselves because the tightness is present. So that's probably more of a true adhesive capsulitis or frozen shoulder when it comes to diagnosis, since sometimes it can be a little bit generalized. So let's dive in a little bit further. Let's look at the mechanism of injury. Many times it's due to an outstretched arm, meaning you have a trauma where you fall, land on that area, or maybe someone does a quick jerk as far as a quick pulse to the arm. So that quick pressure, that tension on that shoulder capsule irritates the nervous system for some reason. But then often too, it could be as simple as you reaching behind your back with the outstretched arm and something gets stretched at a fast pace. What this does is, again, it irritates the nerve, it irritates that surrounding area, so there's inflammation, but then also could be referred pain depending on what structure is involved. This gets a little bit more detailed, needs a therapist or someone to really go in there and understand the hand dominance, the patterns that we go through, understanding the previous limitations that are restrictions there that are leading to the pain that you're experiencing. That way it's an easier diagnosis of what all is involved structure-wise. So that leads us to the next point, structurally what's going on. Many times we look at the frozen shoulder as definitely thinking about more of the capsule around the shoulder, the surrounding muscles. So sometimes there could be a little bit of irritation of your muscles around the area, such as that maybe the rotator cuff, or even the deltoid muscles on the outside and into the biceps tendon. This tends to be a little bit more common when someone has a shoulder pain, when they're experiencing the pain in the front. And so again, you can kind of relate it to the hand dominance and the patterns that someone goes through, but when we're really thinking about the frozen shoulder, we want to get clear on what all structures are involved, because that'll also let us know what maybe nerve roots or nerve endings are actually going into the area, causing extra pain and inflammation as far as referred pain. So a common one, for example, a lot of people will experience is, maybe they had moved their arm behind reaching for something, or just a quick jerk, so that biceps tendon's involved, and understanding the biceps tendon actually inserts into the labrum as far as the capsule itself. So there's congruency with where the fibers connect to each other. Then there's also a lot of times where they have referred pain into maybe the front or even the side of the arm, into the deltoid muscles. But here's the thing that helps us get a little bit more definitive with that is there's what's called the axillary nerve. There's nerve endings and also congruency as far as a shared pathway of the nerves where they refer pain to these areas. So it gets us, and more into the diagnosis and stuff you don't really need to know as far as understanding it sometimes, but it does help with the treatment method, understanding clearly where is the pain coming from and how that connects. So for example, with the axillary nerve and the pain that people often experience in the front of the biceps tendon or the deltoid, it's also connected into the anterior, inferior, that meaning that anterior, that front part of your shoulder capsule. So there's a connection there. They're all, again, that's a lot of even though they're different layers, there's a connection of how the fibers in general come together, even though they're different types of soft tissue. So that being said, it definitely helps as far as a treatment standpoint, understanding like what structure is involved, how to go about doing it. And that leads to the third point, is looking at the treatment methods. And really what looking at with the shoulder adhesive capsulitis or the frozen shoulder, the tightness is, first is, we have an irritated nervous system, you have inflammation, you have tightness. So the goal is going to be going in there and alleviating some of that tightness. And so instead of just thinking just the soft tissue or the muscles, we want to think about the nerves themselves too. It's like, what can we do to relax that area? So going in there, doing some different techniques to relax the area, just get some general movement, and then understanding structurally what can we do with other areas in that surrounding shoulder that are keeping you out of position, causing extra compression or tightness, such as rib cage alignment, maybe even pelvic hip alignment, stuff like that. So, when thinking about frozen shoulder adhesive capsulitis, sometimes again, it can be a little bit broad, generalized term, but a lot of times it's really going in there and being specific on exactly what areas, as far as what structures are involved, what was the mechanism of injury, as far as how did it actually occur, because it gives us a little bit more detail on which maybe muscle groups, tendons, ligaments, stuff that could be involved with it. Then also looking through referred pain, and then getting clear on a direct path of actually going about and giving you a good treatment plan. Again, the goal is not to go in there and add more inflammation or pain, but sometimes at first it's initial, like getting things opened up is not going to be what they call maybe as simple as it would be of just going in there and doing stretching a simple muscle group. It's because it's tight, it's irritated. In a way, sometimes you think of like scar tissue where things are a little bit irritated and tightened up. They don't want to stretch, not as extensible, but that's the goal, is to use some neural techniques, go in there, relax the area, get things moving, help with the realignment as far as the framework, the bones and joints around there, restructure it, and then you can get to a more solid therapy or strengthening program to stabilize it and return to whatever activities that you're doing. So understand that, again, it can be a little bit generalized as far as term goes for frozen shoulder or adhesive capsulitis, but that's where we're going to get more definitive understanding if that's the exact case that's going on, and that usually lets you know it's due to a restriction in that area that's definitely keeping you from moving, not just due to pain.